Hi, I'm Dr. Sonia Nayyar, and thank you for joining us in my dementia series. Today we're going to talk about the signs and symptoms of dementia. Now, a lot of us, when we think about dementia, we really think that the only complaint is memory. But I really wanted to talk about how there are two different aspects of it. There's kind of the memory symptoms and then the non-memory symptoms. Now, most of the patients come to their doctors, their primary care doctors or neurologists, really with the complaint of the memory. So let's dive into the memory complaints that people have. It really tends to affect what we call episodic memory, and it really tends to affect the memory that the memories that we have most recently than our distant long-term memories. So meaning most people will forget things that they've learned recently, but not things like their date of birth, their parents' name, their children's name, or where they live if they lived there for a long time. What they're really going to forget is they're going to forget things that have happened currently. For example, they just made a dentist appointment and they forget about that dentist appointment. They may forget to pay their bills. They can ask the same question over and over again. These are some traits that we commonly see that it really helps differentiate normal aging from early signs of dementia. Other findings is, we all have misplaced our keys, misplaced our phone or our sunglasses, and that's okay because part of that is normal aging. Part of it is inattentiveness, sometimes at times as well. But when it really becomes bothersome is when it starts to affect your activities of daily living, is what we call it. So people who miss their bills, people who are missing appointments, people who may even forget how to use a simple TV remote or a hair curler if they've used that for long periods of time. These are more concerning symptoms that they can have. Now, outside of episodic memory, we also have visual spatial findings. And really what it means is these are the type of people that will get lost while driving. They may think that their very familiar neighborhood that they've lived in for 2, 3, 10, 15 years even becomes unfamiliar to them. A different type of this is even people who cannot put the name to the face, meaning they can recognize the face, but they don't know the name of that person. So these are different kinds of memory that get affected as well. Next, we talk a little bit about sleep. People with dementia can get sleep disturbances as well. They can have dream enactment, meaning they kind of act out their dreams. They can have insomnia, and it kind of becomes a little vicious cycle like we talked about earlier about some other risk factors. But people who have poor sleep, they are at higher risk of developing dementia, and the poor sleep can worsen the dementia as well. Outside of sleep, we also have language. Language tends to be affected pretty predominantly as well. We all have those moments where that word is just on the tip of our tongue, or we can think of it, but we can't get it out. But sometimes it takes it more than that. People can describe the object rather than actually calling it the name, and this becomes a repetitive problem. Some people can even develop severe speaking issues where they can't get the words out at all or completely miss the word. For example, instead of saying, "Give me my keys," they could say, "Give me the desk." So they sometimes just completely miss the word, and that can be signs of dementia as well. Next, I want to take a few minutes to talk about the neuropsychiatric symptoms. Now, this tends to be one that isn't the main reason why people come to the doctors, but it can be one of the most debilitating symptoms that we have of dementia. And neuropsychiatric symptoms are some of the hardest to control, and most patients, that's what they want to control the most in their loved ones, either in the patient or their loved ones. So what do I mean by neuropsychiatric? When people start with dementia, it can be very minor changes. It could be they're irritable, they're apathetic, even depression and anxiety fall into this, but sometimes it can develop into more severe personality changes. Some people, for example, they could be, the type of the mom who always had her hair perfectly done, her lipstick always on, matching pair of heels, but then you start to see that their personal hygiene starts to get affected. We talked a little bit about irritability, and it can develop into severe mood swings as well. Hallucinations tends to be a part of dementia as well. While in Alzheimer's it tends to happen in the later stages to end stages of dementia, some of the other dementias that we talked about, for example, dementia with Lewy body, it tends to happen a little bit earlier on. And these hallucinations can be visual, meaning they see things, or it could be auditory, they hear things. And they really can be something as simple as seeing shapes or shadows so people aren't bothered by them, to be extremely threatening hallucinations to the patient. So these are the type of symptoms that most family members come to the physician to get treated. Next, paranoia delusions. This can also be signs of end-stage dementia. Sometimes a little bit earlier on, you can see insight issues as well as poor judgment. And those are good things to pick up as well, because that could make the difference of someone driving versus not driving. Lastly, I want to talk a little bit about non-memory issues, and that's appetite can be affected. Patients can have motor complaints as well. Really, the list for signs and symptoms of dementia could go on and on and on. And you know, the main focus of this was really to understand that yes, memory tends to get affected, but it's not the sole symptom of dementia. So absolutely something that should be brought up, and through the care of primary care physicians and neurologists can help better treat patients who have dementia. So join me next time. Next time we're going to talk about diagnosis and what to expect at your doctor's visit. Thank you.